We're going to start with the 1557 carbide again, which the reason we use that burr in the beginning for most of our gross reduction, kind of a rough out of the preparation, is it's a fairly inexpensive burr. It makes it so we don't wear out our diamonds quite so much. And it cuts quietly and fairly clean as long as you keep the flutes clean as well. Now clinically you'd want to use a lot of water with this. In this setting we won't be using any water, but we'll go through the same sequence of burrs that we would clinically. So the first thing we would do is with any indirect preparation is we would check the occlusion to see if there's anything unique about the way the teeth occlude that might affect the way we're going to prepare the tooth. The occlusion is, in the case of this typodon, is a class 1. There is coupling of the anteriors, meaning the lower anterior teeth do contact the upper anterior teeth. So we need to get a minimum of 1.5 millimeters away from the closest tooth structure in the lower arch, and we'll get to that in a few minutes. There's nothing with the occlusion that would change or alter in any way our preparation. So we'll start by breaking proximal contact. You have plenty of room with this burr, so just stay away from the adjacent tooth. And I'm going to go ahead and get my high volume suction in the other hand here to kind of gather the tooth dust. And utilizing direct vision, we'll just open up the contact. You want, as anytime you are breaking contact, you want to angle or aim. You want to aim the tip of your burr toward the gingival embrasure. Don't just cut straight through. You'll create a big ledge down near the margin of your preparation. And the preparation is a little bit tipped anyway, so allow yourself the luxury of tipping the burr a little bit and not ledging it near the margin and staying away from the adjacent tooth. So we'll go ahead and do that. And again, just light brush strokes in the beginning. You'll want to kind of keep away from the gum line. So keep your burr up. Don't get too close. We don't want to get any closer than 0.5 millimeter to the hard gingiva on this typodon. Now obviously that has no relevance clinically, but it does on these typodons. And as you can see, we're staying significantly away from that adjacent tooth, and see that we're able to stay plenty far away from the adjacent tooth when we do that. I'm about halfway across, and then we will do the distal proximal contact. Now as you start to break to the other side, don't let it throw you. Don't let it throw you into the adjacent tooth. Thought maybe we had a bearing out on that. There we go. Now we'll go to the distal. Just light brush strokes, angling the tip of the burr into the gingival embrasure space. That turban almost sounds like it's starting to go on this handpiece. We'll see here if it'll last. So that's the first part. The next part is to reduce our incisal edge by approximately 2 millimeters. When you're finished with this preparation, we may be reduced as much as 3 millimeters, but we'll start with 2. This 1557 is excellent for that because it's a millimeter in diameter, and so we can judge pretty close what 2 millimeters is. The angle that we tip the burr on, it's real easy to keep our incisal edge straight from mesial to distal. But buccal to lingual, what angle do we hold this handpiece on to make that cut? The approximation of that is perpendicular. The burr would be perpendicular to the long axis of the opposing tooth. So an opposing incisor, that would be approximately perpendicular to that, will give you a pretty close angulation for buccal to lingual angulation of this burr as you reduce the incisal edge. So we're going to key off of that opposing tooth. Again, that's just an approximation. And we're going to do 2 guide cuts. They'll both be about 2 millimeters in depth. And that's just an approximation, but our guide cuts are now done, and then we're going to connect them to complete the rough incisal reduction of the preparation. Now we're going to do our facial guide cuts, and this is the first preparation that you've learned where on the axial surface we're actually going to do a guide cut. We want to be 1 to 1.5 millimeters in reduction axially overall. So again, this burr is perfect for measuring approximately 1 millimeter in axially. That's the minimum. And so we'll go ahead and do those cuts. Now we're going to be doing this in 2 facial planes. As is the case with any tooth that is anterior to the upper first molars, the facial axial reduction will be done in 2 planes. And so we're going to do the guide cuts in 2 planes as well. So we'll start with the gingival, the incisal 2/3. And there would be 1 guide cut here. And we're simply paralleling that with the facial surface of our tooth. These typodont teeth don't have quite as much curvature on the facial surface that natural teeth do. You'll find that with natural teeth, the difference in the angulation between the 2 facial planes sometimes is greater than what it will be on these typodont teeth. Nevertheless, there is a slight angle change between the gingival 1/3 and the incisal 2/3 on your facial axial reduction. So I've done the incisal 2/3, and now we're going to just change that angle slightly. We're going to key off of our adjacent teeth and do the gingival 1/3, and that angle will be just a little bit steeper. That is the angle that will be lined up with the lingual axial wall to give us our primary resistance and retention form. So one of the ways to help make sure that you get that angulation right is to turn this just a little bit so that you can see those facial surfaces against the other teeth so that you can help key off of those. Make sure that you don't get too close to the gum line because we want to end up again 1/2 millimeter supragingival when we're all done. Now sometimes you have to lengthen your burr just a little bit to do these gingival guide cuts. So again, there is, and I'm just going to check the depth on my on my others. Yeah, not near deep enough, so I've got to finish those. I got a little ahead of myself, so we're gonna finish our guide cuts here on the facial. And then we're going to just change that angle a little bit and do the gingival aspect. And then we can connect those guide cuts. So we'll do that the same way we did on the incisal. I'm going to go ahead and shorten this again so I don't get too much burr wobble. And then we'll connect those guide cuts. And I'm going to need to lengthen that burr again for that gingival aspect. So at this stage, again, it's kind of roughed out. And it's time now to change to our diamond. And the diamond we'll use for this is the torpedo-shaped diamond. It's, I believe, the 5857016, and it's right there. It's round on the end. It is not pointed. It's not a chamfer diamond. And we're going to refine our facial aspect here a bit now. And then we'll change to that gingival angle. And this is where we're going to start refining a little bit and getting a little closer to the gum line. And I'm going to get a little of that tooth dust out of the road. Okay, and start to refine that axial wall. Again, I'm working on that gingival third right now. I'm going to go ahead and break on through with this distal axial wall just to get that depth right. And now we'll do the same at the mesial. Don't let it push into that adjacent tooth. Always keep an eye on that adjacent tooth. Okay, we'll make sure that we're maintaining those 2 planes of facial reduction as well. And we're going to refine that margin just a little bit. And you can do that by just bringing the tip of your diamond out And just carefully sanding that margin. So that you don't have a J-lip when you're all done. And I think we're doing fairly well. We're to depth. Got a little more to do right here. And right here. So now that we've pretty much finished our facial axial reduction, we've connected the guide cuts. I've got a little bit more right here I can see to do. And we've gone interproximally. We're going to do the lingual axial wall. And the way we do that is we key off of the gingival third axial wall, not the incisal 2/3, or we'll be way over tapered. So we want to line our burr up with the gingival third, verify that it's indeed accurate, and then move to the lingual. You can hold your mirror off to the side like that and line up that axial wall with that axial wall so that you don't end up with an undercut. It's very easy to do so on this aspect of the preparation. So we're going to start now. We've lined up. I can see both facial and lingual axial walls. And I'm starting to cut that wall. And I want to make sure I don't get an undercut. It's real easy to get an undercut between these two walls. Okay, now that I've started it and lined it up, I can come back here to 12 o'clock and just carry it on around now. So we're going to keep the same angle that we just started with. And now we're going to just refine that wall and blend it with our proximal walls of axial reduction. Again, just follow the gum line, keeping approximately 0.5 supergingival. And then we'll refine. We've about got our depth correct. We just want to refine that margin a little bit and blend that axial reduction between all four walls. Check our angulation, make sure that's good. And we'll refine that margin. This pretty much needs to be done in the mirror. And I think we're there. So let's just make sure we don't have an undercut again. I think we're okay from that standpoint. And at this point now, we are ready to do the concavity, the lingual concavity. So we're going to work on that entire concave area. There is a tendency to not make that area concave. And when we don't as a dentist, the laboratory cannot put distinct marginal ridges on those anterior teeth that have distinct marginal ridges with a concavity just incisal to the cingulum, which allows for proper occlusal function. Otherwise, that lingual surface just becomes rather flat, and then when the patient goes into a lateral excursion, they can't disengage those front teeth, and at times it will distalize the condyle. So we have to give the laboratory the reduction in the right places so that they can do a good job with the indirect restoration. So we need to make it indeed a concavity. The best way to do that is with the football diamond, and this is unfortunately an area where it's very difficult to do guide cuts. There is a technique that utilizes guide cuts, but I found it just about as quick and easy to do a lot of open and close with the patient, where you grind some away and you have the patient close, you check, you grind away again, and you just fine tune that lingual concavity. So we have the football diamond in now, and that's what we're going to do next. There wasn't any real, anything unique about the occlusion that would allow us to take off more or less in the concavity. And so we'll go ahead and just start that reduction. Remember, we need to be at least 1.5 millimeters away from the closest tooth structure in the lower arch, and that will be the labio-incisal line angle of the lower incisors. So we'll start on the concavity now. As you do this, you will really turn the incisal edge into probably a very sharp edge, and that will make it so that we have to do a little bit more incisal reduction, and that's why we start with about 2 millimeters, and then when we're done it may be closer to 3, and it's primarily determined by the facial-lingual width of that incisal edge when we've finished with our proper reductions, and the bearings on this handpiece are going, so I need to change handpieces. Okay, so we've changed our handpiece. The bearings on that other one are out, so this one's good, and we're going to continue on. If we look right now and have the patient close, we're getting close to 1 millimeter most of the way across, but not all the way. We're still a little bit closer than that near the mesial and distal aspect. So we will continue to refine our concavity, and it will thin that incisal edge considerably. The other thing that happens when we're doing this concavity, it's really easy to under-reduce without a reduction guide, which you can use on this preparation. But without a reduction guide, it's real easy to under-reduce the area right down by the cingulum. And one of the ways to judge whether or not you're getting enough clearance there on this preparation is to look at the adjacent tooth. If the cingulum on the adjacent tooth is close in its contours to your preparation, you probably are not reduced enough. Try to imagine the same size and shape of tooth as number 8 over your preparation number 9. And if it looks like it might be a little thin in your mind's eye, it probably will be. So make sure that you take the cingulum area down enough so that you have room for your material, and the lab shouldn't have to over contour your material. So we'll continue with that. The whole while making this concave. It is a concavity. And okay, we're getting a little closer, but not there yet. And again, just lots of opening and closing with our patient. Okay, we're approaching 1 millimeter all the way across, and we've got to go another half at least. So let's keep going. Okay, we're getting much closer. I'm a little bit under-reduced toward the distal, so I'm going to take a little bit more there. And then we're going to just kind of refine and smooth that down and make sure it stays a little bit concave. It's time to measure now. We're getting close. I can tell, and this little stick is 1.5 millimeters, and so it should just fit, and it does. So we're now clear enough from the from the opposing teeth that we're going to go ahead and come back to our incisal edge now. Notice what's happened to our incisal edge. It's as sharp as can be, facial-lingually. So we have to reduce the incisal edge now enough so that the facial-lingual dimension becomes 1 millimeter or more. If it's any less than 1 millimeter, it's too thin. It's not strong enough, it doesn't impress well, it doesn't pour well, it's hard to make a die. And so we do need to reduce the length of that incisal edge now, probably another millimeter or so, until we get the right width on our incisal edge. So if we've refined our concavity enough, and I believe that we have, we'll switch back to our torpedo-shaped diamond. We'll line up that burr with, in terms of a facial-lingual angle, perpendicular to the long axis of the opposing teeth. Now that gets a little bit obscure when we go to round, which we have to do at the end, but it's still a good thing to keep in mind. Once we've started that, we can come off to the edge here a little bit. And now we're about 1 millimeter thick facial-lingually. And we have enough clearance from the opposing tooth. All we have left to do now is to round the sharp line and point angles on our preparation. It's very angular now. It would not be suitable for any of the weaker ceramics. And so we will do that. We'll start with the line angle that is created between the concavity and the axial walls. And we'll come to the distal now and do the same. And then we'll get our facial-lingual angles. So this incisal edge will round. And we'll do the same with the lingual incisal edge. And then we'll get these sharp line angles near the distal incisal and mesial incisal. Just a little bit more rounding still. When you're rounding, you really need to look at your preparation from all angles, because it's very easy to miss a spot. I think we'll round that transition as we approach our incisal edge just a little bit more. Again, when you're rounding, take sufficient time to do a good job, to be thorough. Let's check our preparation out here now. A little bit more on the lingual. just think we've got it clean, but it's not. What this needs is a good air-water bath. Okay, I think we are there. And you'll notice now that the incisal edge has probably been reduced a good 3 millimeters, and sometimes that happens with this preparation. We'll make sure that we don't have any undercuts, facial to lingual, because that's very easy to do with this preparation. And it doesn't look like it, it's very parallel. Don't believe we have any J-lipped margins. And we're clear from the opposing arch enough. We're over 1.5 plus, so that's just right on, right on. So we're done.